back to Veterans Health Watch. As you can see, we're doing things in a modified way to continue to bring you information from the VA Maryland healthcare system. And joining me today via Zoom are our hospital epidemiologists to help us get the latest information on COVID-19. Thank you both for joining us.
Thanks for having us.
Yeah, nice to be here.
Dr. Morgan, let's start. I introduced you as our epidemiologist, and in the age of COVID-19, can you help us understand what an epidemiologist does?
Sure. So an epidemiologist, and especially a hospital epidemiologist, is someone who's usually a clinician who has infectious disease training. But then what makes us different from the general clinician is that we try to look at how disease affects populations. And really within the hospital, how to prevent infection in the hospital across the whole population. So that often means looking at what puts veterans at risk and what puts employees at risk, and what can we do to lessen that to make things safer for people to come into the hospital.
I assume you are very busy people right now.
Yeah, certainly I feel like there's job security since COVID started.
Yeah. And COVID, so it's changed so much. It's a new virus. We hear something different every day. To help us to understand, what is COVID-19?
Sure. So COVID-19 is the name of this newly discovered virus. It was discovered in 2019. That's with the 19 part of the name. And it's a coronavirus. And that's what we clearly know about it. It causes a disease that really varies a lot, from mild or asymptomatic infections to really severe infections that kill people and that have killed over 150,000 Americans. So it's a very complex virus that spreads relatively easily, and is causing the current pandemic, with America being the country that's most affected.
Yeah, and Dr. Coffey, the guidelines keeps changing. We keep learning new information. Why do we get new guidelines? It seems like every day.
Sure. So it's a fair question, and I think in the beginning it was really difficult. You kind of answered the question in your question. So as we get more information, we change our recommendations. We want to base any recommendations and preventions and precautions and advice that we give on solid data. And in the beginning, you don't have a lot of data. You just have the guidance from other similar diseases. But as time goes on, we get a lot more information, and then we change our recommendations based on that information. And that means that every time we make a change, those recommendations are getting better and more based in science.
And Dr. Morgan, we talk about mixed messages, and some people, we don't know how people can develop antibiotics after they've been exposed to the virus or have contracted the virus. What is the current information on antibiotics and how long you can still spread the virus?
That's a great question. And it's really key to know, when is it safe to be back around people after you've had a COVID-19 infection? So the CDC recently came out with updated guidance on this, and this was based on a lot of new studies that didn't just look at the test, which could detect dead virus that no longer was infectious, but looked at people and when you could find live virus that could be spread to another person. And the good news is that people are really not contagious after a 10-day period. When they looked at patients who were in the hospital, patients who were out of the hospital, a range of different groups, they found that people stop shedding virus most people stop shedding virus after about 5 days, but essentially nobody spread virus after a 10-day period. And so the CDC has changed their guidance to recommend that the best way of knowing if somebody is infectious is the time. And that if people remain out of work and remain quarantined for at least 10 days after developing symptoms of the virus, and that those symptoms are getting better. So people need to have their fever disappear, their breathing problems need to get better. They need to be improving to know that they're no longer contagious, that those people should be fine to go back to work or to seek healthcare or other things without being treated as though they have COVID. But this does bring up a key point also, which is, when are you most contagious? And what's hard about coronavirus or COVID is that you're most contagious in the few days before you develop symptoms, and then in the first few days of having symptoms. So the people who are really at most risk of spreading, who can sometimes even be called super spreaders because they spread it to lots of people, are those people who have either no symptoms or very mild symptoms because they're just developing their infection. So they actually spread more virus to others, and that's the reason we need to look at a lot of universal approaches to preventing infection.
Dr. Coffey, Dr. Morgan made a great point about when someone is considered a super spreader, before they're feeling any symptoms, and it's so early in the process, which leads us to masking. And what we've learned is our first line of defense. So again, we've been dealing with this for months. Where do we stand with masking and social distancing, and how that helps us to go forward?
Absolutely. I think one of the most difficult parts of this virus has been the uncertainty. And we've talked about that a little bit, about how we're gathering data as this pandemic moves along. One of the things that we have become more certain about is how helpful masking is. And basically, if you don't know when a person is about to get sick, or if they're just at the beginning of their disease, the best thing you can do to prevent yourself is to wear a mask. And if the best thing you can do to protect others, in case you are that person, is to wear a mask. And then anything you do above and beyond that is additive. So if you then can stay at least 6 feet apart, that really helps. Really good hand washing before going inside and outside of each other's rooms, before eating, after eating, and certainly before and after using the restroom. Those are all great ways to prevent any kind of infection, and particularly COVID-19.
Even at the VA Maryland healthcare system, when our patients come in, our employees will see we developed a Stop the Spread campaign to remind everyone it's still important to wear the mask. Don't let down your guard. Keep your distance. Those things are still important, still things we need to do.
Absolutely. I think in this time of uncertainty, control the things that you can do. And you can wear a mask, you can stay 6 feet apart, and you can wash your hands.
Great. Thank you both so much. And for our viewers to learn more about what we're doing throughout the VA Maryland healthcare system to safeguard our patients, our visitors, our employees, please visit our webpage at maryland.va.gov.
I'm Dr. K.C. Coffey. I'm a hospital epidemiologist here at the VA Maryland healthcare system. Welcome back. I'd like to show you the new, easy check-in process here at the Baltimore VA Medical Center. Come with me. First things first, you'll need to put on a mask before you come to your clinic appointment at the VA Medical Center. You must wear a mask at all times when in any of our VA facilities. Next, you can expect to answer some questions related to COVID-19 symptoms. If you'd like, you can do this before coming to the VA by going to our website at www.maryland.va.gov. and click on Screen Pass. It'll prompt you to answer questions and give you a screen that looks like this. No Wi-Fi? No problem. Someone will always be available to help you through your screening. As usual, you'll enter through our security checkpoint. But once inside, where you go next depends on the location of your appointment. Just look for this sign to guide you to the correct clinic check-in location. To prevent the spread of COVID-19, you will not be able to use our check-in kiosk. Instead, if you're scheduled for a visit at a clinic on the right-hand side of this sign, proceed directly to the clinic. If you're scheduled for a clinic on the left-hand side, you'll check in on the second floor, where our canteen dining room used to be. As you can see, this new centralized check-in and waiting area has been modified to meet social distancing guidelines. There are 6 check-in stations, and no items will be physically passed between patients and the clerk. Even insurance cards will be scanned by the patient themselves. After you check in with the clerk, you will receive a number. You will then be able to take a seat in our new waiting area and wait for your appointment. The new waiting area was specially designed to maintain social distancing from other patients. When the clinic is ready to see you, your number will be displayed on the monitor. Once your number is displayed, you may proceed to your clinic visit. We are working diligently to reduce the number of patients who are in each area throughout the medical center at any one time to maintain social distancing. We appreciate your flexibility as we work to ensure your safety while serving all of your healthcare needs.
Social distancing guidelines can be tough on everyone, but for our veterans, it could be especially difficult. The loneliness, the isolation, can exacerbate mental health conditions and even lead to thoughts of suicide. So today we have two members of our suicide prevention team here to help us address this specific issue during COVID-19. Thank you both for joining us.
Thank you for having us.
Yeah, thank you very much.
During this time, during this pandemic, we talked about, I mentioned the social distancing. What are you hearing from our veterans? What kind of information are they giving you about their mental health conditions right now? Nikole?
Well, I would say that mostly people are saying that the socially distancing required for COVID-19 is really increasing their isolation and preventing them from connecting with their network, you know, whether it's their friends, their families, their NA or AA groups. And so it can have an impact on their mental health issues.
And Jonathan, what are you telling our veterans? What kind of tips are you giving them right now when they're experiencing this?
Some of the things we are specifically like with the 12-step groups, they've all gone to online style meetings or even meetings like what we're doing right now. So I remind them that, also get them the information and the links that they need to find those meetings. And you really can go online, just Google NAAA in your area, and it'll show you where those meetings are and how to attend. And also telling people to, you know, get good with their technology, like learning this, for example, Zoom. I have some friends who play games online that are like trivia games where everybody's on the screen, and it really does kind of help take away that feeling of isolation. It's funny, when this first started, certain folks who have PTSD, for example, liked it because they didn't have to come to the VA. They could do this and meet with their provider this way. But over time, that's starting to wear on them as well. And it's also, avoidance is really what you don't need when you have PTSD, and it can increase the symptoms, which of course can increase the risk of suicide. So I'm trying to remind people that they need to get out. They need to at least go for a walk, take some time, and have a schedule. You know, make a schedule for your day. If you're not going anywhere, have some consistency in what you do.
In addition, we wanted to make sure that our veterans know how to adjust their safety plan so that it does consider social isolation and maybe have a plan of social action to keep themselves busy to avoid a crisis.
And Nikole, for our patients' families who are watching, veterans' families who are watching, some of them are involved, of course, in their loved ones' safety plans. What can they do to help their loved ones during this time? Maybe even if they don't live with them, how can they help them?
Just be mindful that this is a difficult time due to the social isolation. And also some of our veterans are testing positive for COVID, so that adds an additional stress. But incorporate some check-ins, you know, maybe once a week where you call your loved one or FaceTime with them just to check in and see how things are going. Those are really helpful. I also want to remind families that they can call the Veterans Crisis Line and reach out to if they have questions, or if they want to make sure that their loved one gets connected to VA care or even care in the community. Our suicide prevention teams locally can really support them with that by making that first call to the Veterans Crisis Line.
That's great. Jonathan, for our veterans, we've talked to you guys before. You always come on the show and give us great information. And you talk to us about those safety tips, the gun locks, making sure that certain things are not as easily accessible. Now that veterans are coming to the building or coming to our VA medical centers, if they have scheduled appointments, how are you getting those gun locks or those safety precautions to the veterans?
What we're doing primarily is I'm relying on the veterans talking to their care person, whether it be mental health or primary care or elsewhere, and then that person can contact me, and then I can mail those to the veteran. That way we don't have to interact or touch anything, and that'll be a few days once it leaves here to get to the individual. Other things we talk about as well. Make sure you keep your firearms, if you have them, locked up and separate from the ammunition. Also lock the ammunition in a separate place. In some cases, we recommend people either freeze the key. I have a veteran friend who actually removes the firing pin and freezes that, because if he bashes that with a hammer, he'll ruin the firing pin, so it'll slow him down. The whole idea being to slow a person down. Also, we recommend using things like lock boxes for medications. And maybe give that key to somebody else. That way, I always remember to take my medication, and the person who has the key always remembers that I did take my medication. That way I don't over-medicate or under-medicate And if that's a risk, having medications at hand, it also helps slow down that process again. So those are some of the things we talk about. We offer gun locks, like you said. We also offer 1-week pill boxes and a number of other little things that the providers know we have.
We talked about the family being involved and having those tips, and that is important to look for certain signs and symptoms in your loved one, and that we shouldn't be afraid to mention the word suicide or talk about it. Talk to us about that.
Well, noticing a significant change. If someone is behaving differently than they usually behave, or there are factors like maybe they lost their job, or they have a medical issue, or a significant loss of a relationship. Those are the things that, should be kind of a flag for you to look for some of those more specific risk factors for suicide, like whether they've been isolating. And also, don't be afraid to ask the question, are you thinking about suicide? Because that is the most important question to ask. A lot of times people are thinking about it and they don't share it with anyone. But if their family is able to say, are you thinking about suicide? Or I'm concerned about you because I noticed this. It actually gives that person really permission to talk about it. It says, I'm okay with this conversation. If this is what you're feeling, I want to help you. And it really opens up the conversation that can lead to help.
And I think we can't stress enough the Veterans Crisis Line. If you could give us that number to remind veterans and their families that they can call this crisis line 24 hours a day.
Yes, it's 1-800-273-TALK or 273-8255. And family members can call themselves for a loved one. It's ideal if the veteran reaches out, but if the family is unable to get that help any other way, they can reach out in emergent situations as well. If they feel like that veteran needs someone to talk to immediately, they can call themselves and make a third-party referral. And the idea is just to get the veteran the help that they need.
Mm-hmm. And Jonathan, we talked about some, of course, some of our facilities, we're seeing some seeing some patients face-to-face, but we're still stressing the virtual care. And for those veterans who are using the virtual care, what are some of the activities or options that you're offering for mental health care for our veterans?
Okay, depending on the service, there are some groups that are being done in a format similar to this. I know PTSD programs are doing that. Most of it's happening one-on-one though with the individual. And some of the veterans, what I've noticed is they don't want to be seeing their provider or being seen by their provider in this format. So what they're doing is they're just having a telephone call for 45 minutes or an hour. So we can work at pretty much any way we want to. Whatever it takes to get it done, we can get it done. And I've noticed that a lot of people are being very creative about that and very helpful, which is really good. Great.
And for both of you, if Nikole or Jonathan, while I have you, if you could go first, what can the general public do to support our veterans and to let them know that we're here for them?
Couple things I've noticed during this time that I think is kind of interesting is that everybody's having a difficult time at different times. It seems like we joke about it in my neighborhood. Somebody blew their scene, they're blowing their scene because everybody's feeling the stress of this situation. I think taking into account that there are veterans out there and that this can be a particularly difficult time considering everything, to keep that in mind and ask, just check in with folks, be friendly. One of the silver linings for COVID, my wife and I have been talking about, is that we have gotten to know our neighbors extremely well over these last few months because we see them all the time now. I know who my neighbors are now. So this really can be an opportunity to get out there, staying 6 feet apart, but getting to know who people are, where they're from, are they veterans, what are their experiences? Really just to try to be more, reach out more and just check in and be aware that people are having a rough time all around us. Yeah. And in some ways also excuse them for their faults sometimes because we're all having a difficult time. That's what I've been talking about.
What about you, Nikole?
Well, I was going to just add that, in regards to mental health in general, we all have a responsibility to decrease the stigma, to really help other people recognize that just like our physical health, our mental health is so important. So even hashtags like Be There for veterans, it's really just letting people around you know that even if you're not a veteran, it shows your that you're supporting mental health issues and mental wellness. In other ways, you can, check in, like John said, check in with friends and others, just to let people know it's okay to not be okay, but you have to really get the help that you need when you need it.
And for us here on Facebook, we have a Facebook page that the VA Maryland Healthcare System does. And if you're on Facebook, you can give a veteran a virtual hug. So we've developed a frame that you can put your photo in. You could cross your arms like you're giving a hug, you and your family, and use our frame, and our veterans can see it and feel that support. And here's a picture of me and my family giving virtual hugs in honor of my father and my grandfather who also served. And any veteran in crisis, we want them to know, as we've mentioned before, the Veterans Crisis Line is available 24 hours a day. People are ready to help you. So please call them at 800-273-8255 and press 1. Someone is there to help.
When I came back from Vietnam, and with all the veterans I knew, most of us knew nothing about the term PTSD. 10 years ago, I came into the VA and I got a mental health evaluation. I started getting counseling and group therapy and individual therapy. My advice to a veteran is don't wait until you're totally in crisis. Go into the VA, seek the assistance of those who can help you, just like they helped me. I'm a veteran. I choose VA. I choose VA.
The COVID-19 pandemic is causing anxiety and worry about our health and safety, our loved ones, our financial stability, and uncertainty about the future. The COVID Coach app can help you get through this time of uncertainty by teaching you how to practice self-care, find ways to stay socially connected while being physically distant, find meaning during this stressful time, and cope with the many challenges you may now be facing. Let's explore the 4 main sections of the app. In the Manage Stress section, you can find coping tools to use when you're feeling upset, anxious, or stressed. These tools are all designed to be used from the safety of your home. Use Connect with others to feel less isolated, mindfulness to slow down, or indoor activities to find fun activities you can safely do in your home. Tap the thumbs up for tools that worked well for you so you can find them again quickly in the Favorites tab or on the home screen. The Learn section provides information and resources to help you stay mentally and physically healthy during the outbreak. In the Staying Well section, you can explore topics such as dealing with loneliness, managing financial stress, and worries about exposure. Staying Balanced provides tips on how you can stay positive and keep a routine while stuck at home. You can also find information on helping your family and maintaining healthy relationships with them while you're staying together at home. The Staying Safe section has helpful information if you're dealing with intimate partner violence, substance abuse, thoughts of suicide, or other potentially dangerous situations. The Staying Healthy section has information and resources to help you maintain your physical health with tips on hand washing, physical distancing, and what to do if you get sick. In the Mood Checks section, you can take several short assessments to check the current state of your mental health and track changes over time. When you complete each assessment, you'll be given helpful feedback based on your score, including tools that might help you feel better. You will also be able to see a graph of all your past scores to help you track how your well-being is changing over time. In the Mood Check section, you can also set personal goals and track your progress toward achieving them. Try to work toward your goal every day. You can set a reminder to log your progress by tapping the clock icon on the home screen. You can also set reminders to take the other Mood Check assessments. Using the Find Resources section, you can locate online resources for getting professional help. You can access resources to support you through new challenges you may be facing during the COVID outbreak. like meeting your needs, finding reliable COVID information, or helping children and older relatives cope. COVID Coach is free and easy to use, and it's also completely confidential. COVID Coach doesn't collect any personally identifying information. Download it today and get help managing your mental health and well-being during this difficult time.
I choose VA for healthcare because the VA, they understand veterans.
I heard about the VA from some friends, so I decided to check it out for myself, and I'm actually glad I did.
And VA provides services with veterans in mind.
I also have private health insurance, and I can see any doctor I want. But as a veteran, I like the care that I receive at the VA.
I'm a veteran.
And I choose VA.
I get up in the morning, walk my dog, get in my car, turn on my GPS, and my GPS states going to help my veterans with a smiley face because it helps motivate me to know where I'm going and to clear my mind. That's how I start my day.
You cannot find a more noble calling and mission than we have at Veterans Crisis Line. I know that our Team VCL, saves lives every day.
The job of the Crisis Line is to rekindle that spark inside of somebody. Rekindle that. Because the fire is almost out. And when the fire is just about out, that's when suicide can happen.
This is a calling. I 100% believe the people who are here, they're here for a reason, and they have purpose on helping to contribute to save lives.
Crisis looks different for everyone, and we are going to do everything we can to save that life or to help that veteran.
It's like you are talking to someone at the worst hour on the worst day of their life. I have a split second to try and make a difference and to be whatever they need me to be. I can make a difference in the next few days or few years of their life. So just to be present with them.
Me as a veteran myself, when I got out, I didn't think that there was any support for us, especially back then when I got out. But nowadays, there is good support for you.
There are veterans out there who may need our help and may not know to call us.
We have the training. We have everything, all the tools in place, and we will do our best to connect and get you the help you need.
I can let them know in some way, shape, or form, read between the lines. I know what you've been through. This is hell on earth for you. Let's get you the help that you deserve.
Your crisis is whatever's important to you, and we're here for you. So whatever you're going through, we can support you.
Thank you for calling the Veterans and Military Crisis Line. This is Unica speaking. How may I help you?
Many of us come with different experiences, different backgrounds, and we're able to all bring it together to help each other.
You're not alone because you can give us a call, and you don't even have to give your name. And it's easier to talk to a stranger than it is to talk to someone that we know at times, because then we don't feel like people are judging us. And you're not gonna get judged when you give us a call.
I always say to myself, well, if my dad was to call in, how would I want somebody else to answer the phone for him? This is somebody's brother, cousin, friend, son, so that kind of always stays with me in the back of my head. So that's what fuels me.
The phones, the chat lines, the text lines have not stopped, which tells me the word is out there that this line exists, it's there to help, and it does help.
How could you have a better job than to be making an impact for a population that deserves everything we can give them?
This wraps up this edition of Veterans Health Watch. If you're a veteran, apply for VA healthcare today. You deserve it. Just visit our webpage for more information. You can find more episodes of Veterans Health Watch on our YouTube channel. Just type in VA Maryland Healthcare System in the search bar. And be sure to hit the subscribe button to get notifications of new videos. Don't worry, it's free. We'll see you on the next Veterans Health Watch.